Autism per se is not a mental illness, but autism may be associated with many issues like depression, anxiety, and so many other things. Am I going to give medication for this? Do I need to give medication? If so, what? I will not say that I cannot do that, but I would prefer to get the opinion of a pediatric psychiatrist who would know this part better. If we put a child with autism in the center, there are multiple persons involved in management of this child with a lot of overlap. Hadn't there been an overlap, there would be gaps. So we prefer an overlap, but the understanding should be similar and there should be a mutual understanding. Autism is different for every child. It has to be customized. Everybody doesn't need every sort of therapy. This is where we talk about multidisciplinary or even better, transdisciplinary approach.
Dear parents, you have noticed something. When your child isn't talking, when there is some delay, you immediately, you get tensed up. You consult a developmental psychologist or a child psychologist, and they immediately refer to even a developmental pediatrician. And there the confusion begins. Who is a developmental pediatrician? It's a new word. We often hear about developmental psychologists, child psychiatrists, even child pediatrician, right? So, hello everyone. Welcome to India Autism Center podcast. I'm your host, Ms. Pooja Datta. And today, to give us clarity and insight into this, we are joined by Dr. Nandita Chattopadhyay. So, Dr. Nandita Chattopadhyay is a retired professor of pediatrics, MGM Medical College. She is also the Vice Chairperson, Growth and Development Chapter of Indian Academy of Pediatrics, Chairperson of Unmesh Child Development Foundation, and also the Fellow of National Neonatology Forum and Indian Academy of Pediatrics. Ma'am, welcome to IAC.
Thank you.
So it's a pleasure to have you here. Ma'am, based upon your insights, we know it is going to benefit a lot of parents who are watching out there. So to start with this confusion, who is a developmental pediatrician? Because we all believe that child pediatrician or child specialists, they are the first point of contact. So how does it differ from typical, child pediatricians?
Wonderful question. Yes, developmental pediatrics is a new branch of pediatrics, new in the sense it has come around maybe for the last 50, 60 years across the globe. Now, your question is how it is different from pediatrics. Yes, we are all pediatricians. I would start with an analogy like a cardiologist is different from a general physician because of the specialty that general physician, MBBS doctor has gone into or an MD doctor has gone into. Similarly, developmental pediatrics is a specialization on top of general pediatrics. And whereas the difference lies in the fact that a developmental pediatrician focuses on child development. It includes the neurobiology part of it, the understanding of brain development, and then the different domains of development, how a child is developing, looking at that. Normal development, what causes development aberrations or what helps normal development. From there, we go into the different developmental challenges or delays that are possible, which again encompasses a lot of issues. It may be physical, like we've heard about cerebral palsy. It may be cognitive, as we see in intellectual disability, and it may be a hearing impairment with speech disorder. It may be behavioral problems, as we see in autism, as we see in ADHD and various others, some mental health issues. So many things together come under the purview of development. And this encompasses the whole subspecialty of developmental pediatrics.
So how is it of help to autism and intellectual disability. And we usually, when we hear about doctors, we usually see they prescribe medications, but we know for autism, for ID, there are no medicines. So how do a developmental pediatrician may help?
Well, there are two issues here. Number one, when you're talking about these developmental problems, which we call clubbed together under cognitive and behavioral problems, well, a general pediatrician comes across these cases, and as a general pediatrician is trained to understand these problems, at least suspect them, let me say, but they do not, it takes a lot of time to come to a proper diagnosis and management. A general pediatrician lacks that time, and also maybe a little more knowledge base and skill is important. That is where they refer to the developmental pediatrician. And here, what our role as a developmental pediatrician is to start with, if we have to do the screening, okay, if the pediatrician has already done the screening, there is already a possible diagnosis of maybe intellectual disability, maybe autism, whatever. But as a DP, we do a detailed assessment clinically, we take a detailed history, understand the whole circumstances, come to a clinical diagnosis, suggest the required tests that need to be done. They may be blood tests, they may be some X-rays, MRIs, etc. But very rarely, not for all. That understanding who would need a test comes from the developmental pediatrician. I'll come to why a little later. And then also sort of getting the psychological test done, which test is required for whom. So this is the investigation part of it. Then coming to a complete diagnosis. See, intellectual disability or autism is not a singular diagnosis in itself. The etiology, the cause has to be focused on. The other, there may be other illnesses associated with it. No two persons have the same prototype. So identifying those other underlying illnesses, those other accompanying illnesses, that is the role of the DP, who knows the whole spectrum. And then after the investigations gets a more clear picture, and then it is the DP's role to assign a proper management protocol. Here comes in the issue of medication. Yes, autism, the core symptoms of autism does not have any medication. So we do not prescribe medicine to cure autism. No, never. Similarly, ID cannot be cured with a medicine. But there are role of certain medications to treat the other physical, medical problems that may be associated with this. So once we diagnose that one child is having, say, severe constipation, that is leading to pain abdomen, that is leading to more behavioral problems. So I have to treat the constipation in a proper way. Some children have convulsions because that child has another neurological problem which is leading to maybe autism. So onus of diagnosing every single child, a complete diagnosis, not just one word autism, that will lead to making the proper management, including medical management. There is scope for medical management, though not to treat the condition itself. I hope I've been clear in.
Yes. Following this, ma'am, it was very clear to us. So what is, because even we know that a clinical psychologist also does clinical assessments, the psychological assessments or the developmental assessments. So if a person is visiting you, if a parent is visiting you, what is the protocol for the assessment? Because again, I find there is an overlap. So if you can come across the overlap as well as the differences.
You are very right. There's a lot of overlap. There are many specialists involved. See, if we put a child, we'll be talking about autism. If we put a child with autism in the center, there are multiple persons involved in management of this child with a lot of overlap. Hadn't there been an overlap, there would be gaps. So we prefer an overlap, but the understanding should be similar and there should be a mutual understanding. This is where we talk about multidisciplinary or even better, transdisciplinary approach. Now, coming to the question of a psychologist versus a developmental pediatrician, both have their own roles, important roles. Yes, with a lot of overlap. Now, before I go into this issue of overlap, let us look at the role of the psychologist in this gamut. It is somewhere like I can give you a very simple analogy of a patient, an adult patient coming to a internist, a doctor. The doctor examines the patient, takes a history. He suspects diabetes clinically. Now, what will he do? Will he give a medicine then? No. He needs a proof. He sends the patient to a laboratory. Now, the lab does the test. The lab technician gives the figure, which is actually confirming diabetes. But is the lab technician going to give the diagnosis? No. The patient will not take the diagnosis from there. This lab test comes back to the doctor. Now the doctor conjures that along with the clinical picture that he has, the other paraphernalia around this problem, and gives a complete diagnosis, diabetes with its type, with its complications, and then the management. This is exactly the difference and the overlap between the developmental pediatrician and the psychologist. When we suspect some of the tests, the screening we all do, and when I'm suspecting autism, maybe a 5-year-old child or a 4-year-old child, I would like to do a assessment test also, one of the simple assessments like many of you have heard about ESA or INCLIN, the Indian ones, or CARS, which is from the West. Any of these, we have these tests, and a DP must know how to conduct these tests. In some cases, we do it when we want to do it ourselves, but we don't stop there. Because the whole psychological battery of tests, the psychologist would do much better than me. I might need some intellectual testing, that is IQ testing as well for this child. I might need psychometric testing. So for the whole picture, I would refer to a psychologist. Now, he or she is much more equipped. They do the detailed testing. They come up with scores and they send it back to us. Now, we integrate it into what we have already seen, the whole picture. The puzzle fits in now, and then give the final diagnosis. So this is where overlap is important. Overlap is there. They will also do an ESA. But again, I would mention here, definitely for the same patient, we would not get the same test done twice. No. If I do one test, I would mention that I have done this. This is the score I got, but I would want some more tests to be done, which the psychologist will do in details and give a detailed picture.
It is clear.
Thank you.
It is clear. It was really vague and it is still vague because like you said, ma'am, there are so many overlapping disciplines. Who is doing what? So, ma'am, again, if we come to the overlap and the differentiation between a developmental pediatrician and a psychiatrist or a neuropsychiatrist who are dealing with child cases, because we know that there is a trend first to send to a psychiatrist. So the child is having this behavioral problem. So without having the background known, professionals are referred to a psychiatrist who is dealing with child cases. So what's your take on it?
First point that I would mention is the trend is changing. People are now aware about this unknown entity of a developmental pediatrician for children because, as I said, all these specialities are extremely important, but and there's a lot of overlap. Like to become a DP, the specialization that we had to do, we had to learn a lot about neurology, a lot about psychiatry, child psychiatry, about behavioral pediatrics, social pediatrics, and about all the therapies that are done. But do we know enough? No. We know maybe psychiatry a little more than the general pediatrician, but the child psychiatrist knows much more. So that is how the spectrum runs. Similarly for neurology. Now then the question is, where is the importance? Again, let's go back. Who is the central person? The central person is the child. Our concern is with the child. Now the child, again going back to a child with autism, there are autistic features leading to behavioral problems. Along with it, it may be a neurological disorder giving rise to autism, which we call secondary autism, with some brain pathology. That child may be having seizures. So yes, I will treat the seizure, but I would also prefer to have a child neurologist take a look at this child. This is the overlap. Not that it's out of my arena, no, but I definitely honor the knowledge and skill of the neurologist who would know that part better. Similarly, coming to psychiatry, psychiatry deals with mental illness, right? Autism per se is not a mental illness, but autism may be associated with many issues like depression, anxiety, and so many other things. So, when I get a child with autistic features and maybe aorta of depression or anxiety, am I going to give medication for this? Do I need to give medication? If so, what? I will not say that I cannot do that, but I would prefer to get the opinion of a pediatric psychiatrist who would know this part better. So herein, again, that overlap is very important. Everybody has a role to play, considering the fact that this child has multiple areas of involvement, multiple problems. But at the end of the day, what we feel as DP is our role is more to integrate. You need a central person to sort of integrate all that is coming in and deliver it to the parents. Along with it, another aspect I should have mentioned earlier that we do a lot is the counseling part. For a new diagnosis, parents are not ready. We need to give time, we need to explain the situation. And even as days go on, there are issues of denial, there are issues of new questions, new problems coming up. They have many questions, very naturally. Who's going to answer these questions? And that has to come from a comprehensive answering, not from any one angle. That is one area where finally we do this with 1:1 with parents.
So, ma'am, like it's developmental pediatrician. So, do you have a limit, like age limit, till this you
Very good.
give
Yes.
consultation?
Pediatrics is now considered up to 18, 0 to 18 years. United States is taking it to 21. We are still at 18. So that way we are dealing with young children as well as adolescents. Adolescent autism in adolescence is again another totally different chapter, but we do have to take care of that. Adolescent medicine is something else that we have to take into our purview.
To the viewers out there, if you feel that this video matters, it is insightful, do not forget to share this video with the ones who really need it. Back to the podcast again. So, ma'am, a lot of questions are coming to my mind. Parents, they know what is early intervention because awareness is now created. But to go, the protocol, if we see, what is the protocol for management of the child? The comprehensive protocol from a professional's standpoint. And how does it differ when you are giving consultation to an adolescent client with autism?
Okay. Two questions apart. Coming to the protocol, protocols vary. But if we come to the central point, but the dictum should be a multidisciplinary, even better, a transdisciplinary approach for the benefit of the parents, where they get everything under one roof, one after the, and that is one point. The other point is, as I said, there should be a central person who understands the whole problem from all aspects and sort of binds together all the pearls in a necklace. And this is how the delivery should be best. And transdisciplinary means that everybody is joining hands and overlapping with the others. Multidisciplinary is what we can do most of the times. The difference is that the overlap is a little less. Anyhow, coming back to the point that if it's under one roof, one person central, and then everybody else has something definite to contribute, parallel to this, everybody should understand what the others are doing. This is very important. There is another term as developmental specialist, which I really like. Instead of calling a person a physiotherapist, an occupational therapist, a speech therapist, if we can call all of them, yes, they are that, but they are all developmental specialists. So the basic knowledge, the basic output to the parent will be the same platform, each one contributing his or her speciality onto that. That makes it very comprehensive for the children and for the parents. Coming to the protocol, I will mention what I do. the patient first comes to me. It doesn't start from one end of the circle or one part of the circle. It starts from the center. I do my clinical assessment, investigations and tests if required. I get that done. If not, because autism doesn't call in for too much of investigations, I come to a complete comprehensive diagnosis, plan a therapy, which plan medication if required, and therapy. Because autism is different for every child. It has to be customized. Everybody doesn't need every sort of therapy. So that, and also we have to look at the family's ability, the family's logistics, and taking that together, a framework is done. We tend to go by programming for 3 months, that these things need to be done for 3 months, and then the patient goes or the child goes to the therapists. They undergo the therapy for 3 months. A target has been set. After 3 months, a follow-up is done. In between, all the therapists and myself, we meet together to discuss this child's progress. So this is where everybody has something to offer and something to share. This is more or less the protocol that I prefer to follow.
So, ma'am, like you said, this interdisciplinary collaboration, do you feel it is not restricted to one, but in our scenario, in the Indian scenario, practically, is it happening?
It has started to happen. It has started to happen, and even therapists, when they, instead of just giving their own therapy, they would like to collaborate with somebody else so that it is more of a holistic nature. But my request would be, have a medical opinion at the center to make it more useful for the patient. Because otherwise, one thing is happening at some places, pardon my mentioning this, but it sometimes becomes like, 5 blind people describing an elephant. We all know the story. So instead of doing that, join hands and together feel the elephant so that you know exactly how it is.
Very well said, ma'am. And this is the scenario. Yes. Like, there are so many specialists working together, but in silo.
In silo, yes.
Yes.
Everybody is important, but we need to hold hands.
Yes. Ma'am, nowadays we find non-conventional therapies, dance and movement therapy, play therapy, art therapy. These are also very upcoming. What's your take on these therapies based upon your experience?
Pardon me, a disclaimer at the beginning. My opinion is absolutely mine. It may not hinge with everybody else. But therapy, the word therapy is very important. It has a specific meaning. It means that a particular problem will improve or resolve with certain techniques. And there should be a good lot of science behind it. When a physiotherapist or an occupational therapist gives sensory integration, he or she knows what is happening in the brain and which neural connections he or she wants to work on. Similarly, the physiotherapist knows which muscle he is working on and which nerve will be affected because of that. That is therapy. So, we should be a little cautious in attaching the word therapy to every single thing. Music is important in life. Dance is important in life. A smile is important in life. We all know that. But when and how can we call it therapy? How scientific is it? I'm not the right person to comment because I don't know much about it, but I won't take it just like that as a therapy unless I'm sure about the scientific basis.
True, ma'am. Nowadays it's glamorous to call everything
a therapy.
Yes. But it works. But
it will work.
Yes.
When you listen to good music, you feel good. But is that a process to bring a change in the brain? I don't know.
Ma'am, finally, what's your suggestion to the parents who are watching there with a lot of eagerness and anguish?
Hope and patience is the panacea. That's all I can say. Whatever we are doing, we never say that we are going to cure autism. No. Because it's a different way of wiring in the brain, a different way of looking at life. So, we all are different that way. So nobody's changing. I'm not changing to become you. You're not changing to become me. So why think of changing a child from what he is into what I want him to be, what the neighbor's child is? So instead of doing that, we should learn to accept the child. On top of it, as I started off saying, which I say to all my patients and their parents, they asked, will it be cured? And I'm quite blatant in saying that I don't know a cure for autism. But in the same sentence, in the same breath, I also mentioned that I have not seen a single patient who has not improved. This child will definitely improve with proper therapy, proper attention, with your hope and confidence and patience. These are the three major magic words. You can do a lot. You can bring about a lot in shaping this child's life, not changing him, putting him into our mold, but shaping his life so that this person can lead a purposeful life and a happy life. That should be the goal. And that can be done. And over these years, I've seen many children grow up into really useful, purposeful, and fulfilling individuals. I have a special teacher, special educator who is on the spectrum. I had an office assistant in our center itself who is on the spectrum, and many more. So much is possible, a lot is possible.
And that is what India Autism Center is also all about, ma'am. We align with our vision and mission. Thank you so much for your meaningful insights. It matters a lot. To the parents out there, if you feel that this video has made an impact, it is insightful, please do not forget to share this video, subscribe to our channel, and also wait for the next upcoming video session. Till then, you can watch out the video that is popping up onto your screen. Thank you so much.